from the Office of Wellness and Resilience. Hawaii's state legislature passed a law in 2022 that created the first statewide Office of Wellness and Resilience in response to the community's recognition for a collective effort to address trauma-informed care. The mission of our office is to strengthen our state systems and services using healing-centered care principles as strategies to make Hawaii a trauma-informed state. We break down barriers that impact the physical, social, and emotional well-being of Hawaii's people from keiki to kupuna. Since the Maui fires last year, we have been working to help coordinate the mental health and wellness response. Becoming a trauma-informed state will help alleviate some of the impacts of trauma and build resilience in our families, communities, and state workforce. We look forward to working with the Department of Health on the Project Launch grant, helping to address the crisis by focusing on the wellness and resilience of our youth here in the islands.
From the latest Youth Risk Behavioral Surveillance Survey data available for Hawaii, collected during the pandemic, 35% reported chronic sadness and hopelessness, and 17% reported having seriously considered suicide. For younger children, those aged 2 to 8 years, 1 in 6 have a diagnosed mental, behavioral, or developmental disorder, according to the CDC. This is without a doubt a significant public health concern and a priority area to address. Toward that end, we are fortunate to be one of 13 states to have been awarded a SAMHSA grant for Project Launch. Through Project Launch, we will promote the wellness of at-risk young children and their families. We will collect data and learn more about socioeconomic contributors, health disparities, and the development of culturally based interventions. With early identification and intervention, we can have a lifetime of impact.
At Aim High, we nurture the emotional health and resiliency of Hawaii's keiki by growing a network of professionals and a system of care that is founded upon infant and early childhood mental health practices. Our vision is that in Hawaii, the early years are celebrated and revered, first relationships are nurtured, and infant and early childhood mental health is viewed as everyone's responsibility, or as we say in Hawaiian, everyone's koleana. The first few years of a child's life are critical to brain development. Stable, safe, and nurturing relationships during this formative time build resiliency that carries through the lifetime. It is through these relationships that children develop, physically, emotionally, mentally. And since we know that all babies require a caregiver in order to survive, we also know that in order to care for that baby, we must care for the adults in that baby's life. Babies exist in relationships, and these relationships form a broad system of early childhood and community supports, ranging from neighborhoods to childcare, schools, and healthcare settings, all the way down to the family unit. Aim High strives to be a unifying force working within partners across these complex systems to grow understanding and acceptance of the infant and early childhood mental health field and ensure evidence-based practices around first relationships become the norm in Hawaii.
Hawaii is one of 5 states to join a cohort from the National Governors Association Youth Mental Health Academy that will be addressing the mental health needs of our children and youth. Project Launch is a grant-funded project that promotes the wellness of young children from birth through 8 years of age by addressing their physical and mental health needs. The resilience and strength of our children is supported when parents and families have the necessary resources and support. The Annie E. Casey Foundation's 2023 Kids Count shows that Hawaii ranked 8th for nurturing families and supportive communities, stressing the importance of ohana among the culture of Hawaii. Project Launch works to build the capacity of adult caregivers to promote healthy social and emotional development and prevent mental and behavioral disorders amongst families. Hawaii recognizes the importance of coordinating between communities and community hubs where families naturally tend to gravitate to for support. Palama Settlement on Oahu is one such partner we engage in the community where families in the Kalihi Palama area congregate.
In 1900, there was a bubonic plague that hit downtown Honolulu. Many people were left houseless, so they settled here at Palama Chapel. Throughout the next 120 years, we've been doing the same thing here at Palama Settlement, helping our community. So through our health, education, and recreation components, we've been working on our mission, which is to help those in our community with the greatest needs enhancing their abilities through education, recreation, and health. Through that, we've had a volleyball team, basketball team, we've had aquatics, and our iconic football program that we've had here at Palama Settlement. Today we have a digital arts department, we have an aquatic center, we have many things going on. We have a community center for the kids, we have a teen center. Our next phase at Palama Settlement is to work on a preschool because we want to do the very best for our kids and we want them to get the services that they need. That's what we do here at Palama Settlement. We help the holistic child and their families, and helping the families is very important.
Palama gives back to the community, the youth especially. Some of the opportunities here at Palama Settlement that offers my children is various programs like educational programs, sports, activities, and services.
This is like my second home. Then the kids, it's everything here for them. You know, it's a safe environment for my kids and the other kids that come here.
I was born and raised here, and to see Palama giving back to the community is special to me because growing up it's different from how it is now, you know? And to offer so much things, like I said, for the youth especially, it means a lot to me. I look forward to growing as a family and making memories, watching each other succeed later in life. It's just, this is where I grew up and I love that they involve the community and this is what it is, this is where we live, this is where we're from.